All right, so we're gonna run through kind of one of our basic protocols as we get everything going here. As we're going through all this, the big things that we like doing with the laser is pairing the laser, especially from the start, relative to the area that we're working on the body here. So we have the laser right behind the left ear. That's correlating with the left cerebellum. So as we're going through and starting everything, we want to figure out how we're able to give some input to the body that ultimately crosses through that left cerebellum up to the right brain. So we start with a lot of the same reflexes on the same side. Well, we'll start through some of the palmar grasp reflexes and working on some of the hand motions and some of the fine motor stuff from a sensory standpoint. And then from there, we could go right up to the cheeks. This works through some of the rooting reflexes. If you can see right here, every time her lips kind of give a little shut like that, that's actually that rooting reflex. But a lot of things from, let's go there again. A lot of things from the oral facial stimulation side of it, the trigeminal nerve projects up to the brain as well, especially the frontal lobe. So we like doing a lot of stuff from an oral sensory standpoint because we know how important facial tone is. We know how important some of those cranial nerves are. And the more things we're able to do with that, the more it will send projections up to different parts of the brain. Let's go up to right brain there. What our main goal is as we're running through some of this stuff is saying, what kind of input could we give to the brain, both from a sensory motor standpoint, that makes the brain ultimately work a little bit more efficiently? Make new connections happen. Look at that smile. You like being on camera? You like my explanations? What this gives us the ability ultimately to do is to just give activation to some of those neurologic networks that we're trying to do, that we're trying to give more activation to, where we know that the more activation those networks have, the more efficient the brain will be, and that ties over to some of the symptoms that we're ultimately working through. But when it comes to the sensory input that we start with, a lot of it is from a muscle tone standpoint, but it's also just feeling where your body is in space in a little bit higher of a degree, where the more you're able to feel your body, the more you're ultimately able to control your body as well. So that's why we put a big emphasis on some of the sensory input, especially at the start of the session, because right from here, we're then going to segue into some of our active therapies and getting her body moving, getting her body activated. And this is a good way to start with it to kind of just get everything moving a little bit more through here. So from there, we could even run through and work through things on the other side as well. Go to right cerebellum. So the same thing. We start through some of the hand reflexes. You look at the hand closing, you look at the hand reacting. You're able to put different input into the hand to help that control a little bit more. And if we work through the palm, we could work through all of the little fingers through here. We can even isolate different limbs where we could go with the shoulder. We could do a complex movement. The cerebellum likes non-linear, non-predictive type movements, and that's why we do the infinity motion with it. We could do it through the wrist. We can work through all the fingers, and we know that all of this input to the body is correlating up to the corresponding part of the brain that we're putting the laser over, where doing the laser in itself, it's very beneficial, but when we start stacking it on top of some of the therapies that we're doing, let's go again there, it makes the therapies that much more beneficial, where I could do all my oral sensory work without the laser. I could do the laser without this stuff, but that synergistic approach, it just helps everything from a therapeutic standpoint happen a little bit more efficient, a little bit quicker, gets a little bit better of a bang for your buck for all the therapies that you're already doing. And that's what I tell a lot of people that are looking to introduce laser into what they do, is you don't necessarily want to formulate your clinic if you're not used to using the laser around the laser. You more so want to take what you're already doing and figuring out how the laser plugs into all the techniques, all the modalities, all the therapies that you're already doing. So then we can go through here, tickle both cheeks at the same time. How much Genesis? Does that feel weird? Oh, it's like you just ate a Sour Patch Kid, or what are they called? Warheads?
Warheads.
Warheads? Is that what they're called? They still make those?
Yeah.
Huh. They're like the little balls, right? Yeah. So you keep working through the reflexes here. And then we could even work on some of the oral sensory stuff a little bit more. We could take a glove and, if I could pull one out, and we can go, sorry, Jess. We could even go over her lips as well. So we really want to work on some of the facial tone here, activating the mouth, activating the lips, giving all sorts of input. And then we could even get with the laser here, give energy to some of these muscles and nerves with the laser. What do you think, Genesis? Good? In the mouth. Good job, girl. Okay, let's hop back up to left brain here. So then we do same thing through here. So remember, all the input to the body ultimately summates in some area of the brain. And we pair the input to the body relative to the area of the brain. So when it comes to some of the sensory work, there's a lot of different types of sensory work we can do. I personally, from the start, I love vibration. There's light touch, there's deep touch, there's electrical stim, and we do a lot of that stuff, but I think just from a muscle feedback standpoint, having some of the deep pressure does work well. I know a lot of you guys are gonna see this and grab your massage gun, and the only thing that I'll say to that is a lot of the massage guns, they don't have a soft tip to them here. So if you get a massage gun and you're starting to put it over a hand or an elbow or a knee, it's gonna punch you and it's gonna hurt. So try to find one that has a real soft cushion here where I could put this over any limb and it's not gonna have any pain. Where this is called a vibracussor, where it actually vibrates and percusses. This is a really good tool through here. That's good. Okay, this here is called an arthrostim. This is actually one of the chiropractic tools. But how we use this is I like putting this over different joint capsules here. And what I'll do is I'll go through some different ranges of motion while giving input to that joint. So we're working through some tighter muscles here through the left arm. So what I'm doing is I'm just giving another form of input as we do all this, where I could go through, you know, things with the shoulder, things with the elbow. I could work through some wrist type movements. So it's more so bringing things through active ranges of, or passive ranges of motion, while I'm giving input to some of those joints that we're bringing through those ranges of motion. So we could go a lot of different ways with this. We can go distal, proximal, all different ways. Yeah? Tell me how you really feel. And then we could do upper extremity. We could go even through the back part of the shoulder here, some more range of motion stuff. We could go up, 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 up. And then same thing with the lower extremity too. We could work through our hips. And with a lot of clients, patients that have limited active ranges of motion, we want to just give input to them as well, where it's an old saying that motion is lotion. And for someone that has a little bit harder of a time using all their limbs, we want to make sure that we keep things moving the best way that we can. And that's where some of the stretching, but this kind of brings some of that stuff to the next level of getting exactly to the joints and putting some good motion through those joints to keep things as loose as possible and as active as possible as well. So we go up here through the shoulder. We can work here through the elbow. Get down through the wrist. This side isn't quite as tight, so we can move through this a little quicker. We could go down through the hand here, and then we could work our way through the hip. And then we could do some stuff here through the ankle as well. Good, good, good. Okay. So now we're gonna keep some things going from a muscular standpoint. Let's flip that over to muscle. Yeah, this is all locked up. There we go. Okay. So let's start left side of the body. So this right here is a machine that I absolutely love. It's called, here, let's actually do this here. It's called high energy inductive therapy. Is actually a form of PEMF, of magnetic stimulation. There's actually a big magnet in here. And what it ultimately does is we're able to target certain muscles where there's different frequencies that actually helps to decrease like spasticity, high muscle tone, but there's also ones that help to, improve muscular strength, neuromuscular re-education, where we're able to passively put this over certain muscles and get contractions and get stimulation to the muscle, which prevents some of the disuse side of it, but also gives her more of that similar concept with everything else, that whole brain-body, body-brain connection of feeling where her body is in space. So if you can see it on me a little bit easier, if I put this over my hand, you'll see my hand kind of contract through here. And then when it starts going to the lower frequencies, where it cycles up and down, you can see the contractions happen a little bit different of a way. Now, with children, of course, we don't want to go full blast with this, but it's a very, very good way to give some passive stimulation to muscles. So let's go muscle there. So with the laser, we're going to do just that. We're going to pair up the laser with the therapy. Where the laser in itself, that's giving a lot of good stimulation to the muscle here, helping from a blood flow standpoint, an inflammation standpoint. And then when we pair it with the high energy inductive therapy, that is then giving it some of the activation. So when we're working on decreasing some of the tone in this left arm here, we're working at it twofold, where we did a bunch of stuff before. Now we pair some things with the laser, some things with the other devices, and that's a really good kind of combo to run through things. And this is the start of the day here. So we still have a couple hours more of therapy that we're running through, and this is a really good way to not only activate, but we even do this a little bit more in the afternoon from a recovery standpoint as well. So with this, we don't have to keep it static. We can keep some of the passive ranges of motion going with it as well. So we can go over the tricep, we can move this here over the bicep. And we're keeping these limbs as loose and as comfortable as we can, right? Okay. We're gonna bring this down. Okay, let's come over here. Yep. So when we look at laser and light therapy over certain clothing and certain parts of the body, we want to be cognizant of where we're putting it, how we're applying it, where laser is all relative to something called dosing, is all relative to technical calculations, joules per centimeter squared. So we have to look at things that ultimately affects the target tissue. And for example, going over clothes, is it perfectly ideal? Probably not, but some of the lighter colors doesn't absorb light quite as much as like if I were to put the laser over my scrubs, that probably wouldn't get through it all. But some of the lighter colors we can have some impact through, especially when the power of the laser is a little bit not too high, but on the higher side of it. And then also proximity of the laser to the muscle or to the target tissue as well, where if you're holding it up here, you're probably not going to get much to it. In a perfect world, you would be right on the skin, but for a lot of times that's hard to do. So if we pull an inch or two off, we kind of make up with that with the calculations, with the dosing of the laser, to be able to still have the impact even though we're not directly on the skin here. Okay, let's go down here. So with this device, another reason it's really cool is because we're able to use it in so many dynamic ways as well, from the hands to the legs to the feet. With a lot of kids where we're working on something like standing, we'll have them standing and we'll put this right over their glutes, we'll put it over their back to help recruit some of the muscles that we're trying to activate as we're going through some of the therapies as well. Yeah, let's pause that. Let's come around to the other side here. All right, we're going, we're moving. Doing good. Doing real good. Okay, let's bring that head up. No, you're just good. All right, miss, we're gonna do the same thing on the other side. Okay? You know the drill. Not your first rodeo. You got this. Okay, let's go muscle through. So with a lot of the protocols for this, we kind of have some of our base protocols, and then we could get more specific as well. When we're trying to work through and work on some of the whole body stuff, I like kind of doing just that. I'll start, upper extremities. We'll go down to our lower extremities. We could get more specific with things as well, especially as the day goes on. But this is definitely a a good starting point running through some things here, and you'll see in a sec. Another big area that we want to work through is different areas of the spine as well, because there's a lot of disruption to the muscle tone that can happen from a muscle tone standpoint in the spine, and scoliosis and all that not so fun stuff. But also, it works through things from a muscular standpoint, even with looking at some tone from like a head carriage, keeping your head neutral, getting yourself back up into extension in a more proper way as well. So when we're coming up with all this, part of what our goal is here at the clinic is we want to think a little bit outside the box, where a lot of our patients that come through here, they've done a lot of the traditional therapies, and some have worked well, but sometimes we need to think a little bit more abstractly to be able to continue pushing children in the right direction, where everything that we do, I mean, there's literature behind everything, but we also want to figure out ways how we're able to continue innovating things as well, because the more innovation that we have, the new kind of techniques and the new modalities that we can use, where if a child is a little bit more in that plateau stage, we could do things to help to kind of bump them up to the next level of it. Okay, let's hop her up on the table. Okay, I'm gonna get your back, okay? Who's getting the face?
You got the bulk joint plaza.
No, here we go. All right, miss, we're gonna hop up here on the table. Rory, you are.
Let me shed a couple pounds and maybe I'll become. Me, my sister, oh my God, when we were younger, we used to love videotaping.
Let's go same way how we've been doing, sitting here.
We used to love doing like videos and recording ourselves, and I'm like, what happened?
Oh my gosh. Cue holder, miss.
Yeah.
Miss will come get her. All right, Missy, let's do this. Yeah, extra cute. Extra cute. Okay, got her?
Yeah.
Okay.
She's like, I see something.
You like the camera?
She actually
Does she like the camera? No.
I feel like she doesn't. Like, I remember when I would always record her, she was like,
You are too cute to not, Miss Genesis. Okay, so let's talk a little bit more about some of the spinal stuff through here. So when we're looking at the spine and tone, when somebody has any sort of, whether it's a brain injury, whether it's something genetic, whether it's, even a developmental delay, a lot of times you see secondary effects happen from a midline spinal standpoint. And there's a couple of reasons why. A lot of the time, there's different downward projections that come from the brain that ultimately coordinates. The vestibular system, and the vestibular system does have a big impact on some of the spinal stuff as well. Especially if somebody's not as weight bearing, where your midline core needs activation to stay upright relative to gravity, and that's why the standers and all that stuff's important in getting someone weight bearing, because it helps to recruit these muscles and makes them activated a little bit more. So a big emphasis on what we like doing with a lot of this stuff is working through some of the spinal core control of things, because yes, I'm a chiropractor. It's not just cracking someone's back. I'm not going to crack her back, but there's still a lot of things that we need to do from a control standpoint, from a activation standpoint, from a therapeutic standpoint, whether that's reflexes, whether that's vibration, whatever it might be, where the more messages we're able to put to this midline tone, the more is going to kind of fire up to her cerebellum, to different areas of the brain, so she can maintain some of her head control in the most appropriate way possible as well. So a lot of times I like starting down here on the sacrum. That kind of just gives a big input up through the spine here. And then as we work our way up, we could get a little bit more specific with things as well, where we could vibrate her spine. We could go over the cerebellum here as we do it, because we know a lot of this input, especially midline, is going to go right up to her vestibulocerebellum. So we could go all through the spine here. You could give that a break. You could pet Rory. Then while we're right here, we could work on some of the reflexes as well. So, whoa, there's one. So this is a spinal galant reflex. This is one of those primitive reflexes, and kind of the reflexes, you stimulate the spine and you have a little contraction towards the stimulation. Sorry, Genesis. I feel a little weird?
I feel weird or what?
Twice. Okay, then we go up through here. These are all the muscles that keep your head nice and strong, man. Good. Then we could come back and use this to give a little bit more activation to some of these muscles through the back here. Good job. We like when that head's nice and strong. When you keep it right in the middle like that. That's good. I'm next. I need this on my back, if we're being honest. Okay. A little bit more. What are you coughing at? Are you dreaming? Are you somewhere far, far away? You are, aren't you? Oh, there you are. You're a good girl. All right, now we got the taps. You ready? Tap, tap, tap. So this is a little bit more of the chiropractic side of it. So what we're doing here, not anything super specific necessarily, but what this device does is just give some input to some of the joints where I like going up the spine here, and it's just another type of sensory input that we're able to do to some of those more specific structures compared to like the vibration, where it's more like paraspinal based. We're able to get right on some of those joint capsules within the vertebrae to give motion to give input to, and we're able to go through the back. We're able to get up through the neck here. Nice, super, super simple taps. We don't need to crack her up, crack her down to have an impact with this. So it's all good. Good job. Okay, so that's kind of the start of the session here. That was a lot, sounds like the start. But then from here, what we do is we work with other practitioners, and they're gonna run through some more of like the active therapies, from, you know, some of the reflexes to some of the postural control to all the sensory motor stuff. So this kind of primes her body, gets her ready. But even doing this in herself, I mean, this is just a lot of good input from different modalities. And as you can see, the more modalities that we're able to stack on top of one another, the more of an impact it's ultimately going to have.